A colonoscopy is a medical procedure that lets your doctor look inside your colon and rectum for problems such as ulcers, inflammation, bleeding, polyps, and tumors. A colonoscope is the tool used to perform a colonoscopy. It is a thin, flexible tube with a light and video camera on the end. It is inserted through the anus into the rectum and is carefully guided up through the colon, all the way to the cecum. The colonoscope can usually be used to enter the very end of the small bowel, known as the terminal ileum. The front tip of the colonoscope contains a video camera which sends real-time images to a computer screen so that your doctor can examine the colon. The front tip also has a light, a channel for water irrigation, a channel for air and water, as well as an instrument channel. The irrigation channel is used to flush water or air into the colon to remove debris or stool and see more clearly what the inside of the colon looks like and to check for polyps. Special tools such as tiny forceps or wired loops or snares can be passed through the colonoscope to remove polyps and take samples, called biopsy, of suspicious tissue in order to look for signs of cancer. A colonoscopy usually takes 30 to 60 minutes and is performed in a hospital or clinic by a trained doctor, known as a gastroenterologist. You will be offered a sedative to help you relax during your colonoscopy, and you will be placed on your side for the procedure. Your doctor will carefully insert the colonoscope into your rectum and advance it to the end of your colon, to your cecum. The colonoscope bends so your doctor can move it around the curves of your colon. Your doctor might gently press on your abdomen during the procedure or ask you to change positions occasionally to help move the scope through the colon. During the entire procedure, a magnified high-definition video from the colonoscope plays on a monitor in real time, so your doctor can thoroughly examine the lining of your colon. Video may be recorded and photos are taken as well. A small amount of air may be blown into your colon to help expand the passageway so that your doctor can see better. This can make you feel pressure or mild cramping, but can be eased by taking slow, deep breaths. The colonoscope is then slowly pulled out while your doctor carefully examines the inside of your bowel. If your doctor finds polyps or suspicious areas during the colonoscopy, the polyps will be removed and small tissue samples will be taken to be checked for signs of cancer. Polyps are usually not cancerous, but they can change into cancer, and that is why they need to be removed. Polyps are removed with biopsy tools or wire loops that get passed through the scope into the colon. The most common removal technique is called snare polypectomy, where the polyp is surrounded by a wire loop and then an electric current in the wire burns off the polyp. The polyp is then pulled through the instrument channel and collected for biopsy. Other methods are available depending on the size and shape of the polyp. Polyps contain no nerves, so you won't feel pain during their removal. After your colonoscopy, you will be taken to rest in a recovery room until the effects of your sedation wear off. You may feel some gas or cramping, but this will quickly pass. Because of the sedation used during the procedure, you will need a family member or a close friend to drive you home. You should take the rest of the day off and not make any major plans for 24 hours. Before you go home, your doctor will share the results of the colonoscopy with you.
Colonoscopy has two main purposes. One purpose is to check on certain symptoms or conditions that your doctor would be concerned about. The second purpose is to screen your colon for colorectal cancer. A colonoscopy can be used to see problems in the colon in patients who have a variety of serious symptoms. Some of these symptoms can include chronic diarrhea or unexplained changes in your bowel habits, bleeding from your rectum or anus, unexpected weight loss, iron deficiency anemia, or other symptoms. If you show signs of any of these symptoms, you should talk to your doctor. Colorectal cancer is one of the leading causes of death in the U.S. Colonoscopies have proven to significantly decrease the incidence of colorectal cancer. If the lining of your colon contains polyps, there is a chance that these small growths of tissue can turn into cancer. A colonoscopy makes it very easy for your doctor to find and remove these polyps early on before they have a chance to become cancer. During your colonoscopy, your doctor will be able to remove polyps easily using specialized tools. These tools operate by cutting off polyps from the lining of the colon wall and removing them safely. Removal of polyps is painless since there are no nerves in the lining of the colon. After a polyp is removed from your colon, it is sent to a lab for analysis by a trained doctor, called a pathologist. The lab results are very important as they will inform you about whether the tissue sample is benign, i.e., not cancerous, or precancerous. If the tissue sample is precancerous, you will need to meet with your doctor again. There are two main categories of patient risk: average risk and increased risk. It is very important for you to understand which category of risk you belong to. If you are a healthy male or female, age 50 or older, you are considered to be an average risk patient. In this category, it is recommended that you get a screening colonoscopy when you turn 50, since 90% of colon cancers occur after this age. If the results from your previous colonoscopy return normal, your next one can be done in another 10 years. As long as no abnormal results are found along the way, the same schedule can be followed up until you are 75 years old. A screening colonoscopy is the most useful test for the detection of colon cancer. However, your doctor may suggest a different test for you depending on your own medical circumstance. These other tests can be divided into 3 groups: stool-based, direct visualization, and radiological. Stool-based tests include the guaiac-based fecal occult blood test, GFOBT, fecal immunochemical test, FIT, and stool DNA test. Other test options include a flexible sigmoidoscopy, which is an example of a direct visualization test. A computed tomographic colonoscopy is an example of a radiological test. It is important to know that you will be asked to have a complete colonoscopy if any of these other tests are positive for cancer. If you are in the group of patients considered to have an increased risk of colon cancer, it is suggested that you get a screening colonoscopy before you reach 50 years old. If you are a patient who has an increased risk, you may need a colonoscopy more often than patients who are in the average risk group. Whichever group you belong to, a colonoscopy is a procedure that should be done several times over your lifetime because polyps can reappear. Depending on the types of polyps found in your colon, some types have a higher chance of turning into cancer than others. Hyperplastic polyps are a benign type of polyp, which means that they have very little chance of turning into cancer. However, they still need to be removed and examined under the microscope, which will determine if these polyps are hyperplastic. Even if you